Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who like to laugh, love their pets, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things, so welcome to the Dr. Molly Says podcast. I have a friend today.
Hi.
And this is a real friend, not that anybody else wasn't, but this is Dr. Kristen Frevert, and she is a friend of mine in real life, and we actually have been working together a little bit lately. So we'll get into that. So I was just going to tell them who you are, but hi, welcome.
Hi. Thanks for having me. Super excited to be here.
So if you haven't been listening, we're in my new building, which is where the new practice is going to be. And so I was just giving Dr. Frevert the full tour.
It is going to be awesome.
Yeah.
It's going to be awesome. It is something to see for sure.
We're really excited. Walls are going up right as we speak. So we just walked through and it's feeling real. So
the vision is awesome.
We're very excited.
Yeah.
So if you don't know what we're talking about, listen, but I'm opening a practice here in Franklin in September, hopefully, called The Local Vets, and we're doing construction right now. So I've been jabbering at you about it now for 4 months, so you finally get to see it.
It's so good to see it. It's really, the walls are going up. It's
crazy.
I can't imagine what you must feel like.
Oh, I'm so excited.
Yeah.
Terrified, but excited.
So cool.
Okay, so let's talk about who you are.
Okay.
So Dr. Frevert lives here in Franklin as well. We live actually 5 minutes from each other. And I'm going to go through, because I got you to send me all the things, so I'll go through your professional background. Okay. You grew up, this is personal too, but you grew up in New Jersey, went to Notre Dame undergrad. I actually didn't know that.
You didn't?
No.
Oh, born and bred Notre Dame family.
Did you love that? Was
Go
it just
Irish.
as great? Okay.
Yeah.
It was just
My
as
dad
great
went
as
there.
you thought. Okay.
Yeah, my dad went there. My brother went there. Yes.
So it's kind of like me in Tennessee. It's like
Yes.
everybody goes. Okay. And what was your undergrad degree?
Biology. Minor in anthropology.
Did you know you were going to go to vet school when you went to
Yes.
undergrad? Okay. That was the plan.
That was always the plan.
Okay. And then you went to Penn for vet school. So if you don't know this, Penn is one of the cool vet schools to go to. So you're a Penn grad.
We're not stuck up.
And which means what is your title?
My VMD.
Okay, so people listening don't know about this nonsense, so I'm going to need you to explain.
Okay, every veterinary school in the country, except for Penn, every veterinarian graduates with a DVM.
Doctor of Veterinary Medicine.
But if you went to Penn, we are VMDs, veterinary medical doctors.
And somehow they think that makes them better.
I love it.
I don't mean you, but
I love
sort
it
of.
because if I see any VMD after a name, I know that we have something in common, right?
Okay, yeah.
And that's hard to come by in Middle Tennessee.
Yes.
There aren't many
that is
Penn
true.
grads in Middle Tennessee, so it is nice.
Fair.
But I see your point.
At work the other day, somebody was filling out something for me and they put Molly Brinkman VMD. I was like, excuse me, no. I was just giving him a hard time. Sorry, I'm used to it, Dr.
There
Frevert.
was, for the longest time, the letters DVM in our lobby.
And it drove you crazy.
And I'm not a DV. I feel like it's false advertising.
You were like, that is not my title. Okay, Dr. Kristen Frevert, VMD. Okay, so you graduated from vet school in 2009. And then where did you do an internship?
I did not.
Okay.
No, I went straight into general practice. I worked in New Jersey for a few years, went back to Jersey. That's where I met my husband. And then when we got married, he was relocated to this area, got married, moved here.
Okay.
So I was only in New Jersey practicing about 3 years and then have been here since we got married in 2012.
Okay.
Yeah.
I got married in 2012. Okay, so just a year before us. And then have you worked at Little House always here?
Almost. I did a little bit of relief for 6 months time or so. And then in December of 2012, I took the job at Little House. Yeah.
So Dr. Frevert works at Little House Animal Hospital, which is a local privately owned practice where I have been doing like a locum until we open. And so we knew of each other and had been like running into each other because we both have kids in the community. Like, we need to get together. And so now we work together at least one day a week. And the techs probably both love and hate it because we're fun to work with.
We chat. We don't pay attention to what they want us to do sometimes.
We made a video a few weeks ago of like the techs like holding our arms and doing what we needed to do.
Inspired by real life events.
Correct. While we were chatting. So that's what it's like to be at work with us. Okay, so you've been at Little House then for 14 years? Oh my gosh. Okay.
Almost, yeah, a long time.
Yeah. Okay. And then before we talk about sort of like your newer stuff, you're married. Tell us who you're married to.
Drew. Married to Drew. Yeah.
And you have 2 kiddos.
2 daughters. Yeah. Emily and
how old are they?
They're 8 and 11.
Okay. Yeah. And I can tell you, I can speak for her. They do sports and they're good at things. And Dr. Frevert is very into coaching and fanning for these things. So
yes, but it is fun. It is fun. It is lots of fun. I mean,
I love it, honestly.
It is so
it's one
much
of my
fun.
Favorite things about you.
I get a little competitive.
It's great.
At times.
Of course you do. Because you're a veterinarian.
But right. And we can get into that.
Who went to Penn. I'm just kidding.
I just,
So yeah, you're mom lifing 24/7.
Yes.
Even when you're vet lifing.
Yeah. I mean, and that's been, as you know, a struggle at times, and there's a big balance to be had.
Yeah.
You have to set boundaries sometimes.
Yeah.
But it's great. I wouldn't have it any other way. But,
yeah, I know. It's so fun.
Yeah.
And now we get to work together. So recently, in the last few years, you have added to your professional resume, which is really what I'm excited to talk about today. So tell us, let's start with acupuncture.
Okay.
And so Dr. Frevert is certified to do acupuncture, and as of like a few weeks ago, officially, rehab. So I want you to tell us, we're going to talk a lot about both things. But before we get into the specifics, when did you decide, like, I want to do some alternative integrative medicine?
Yeah, I mean, I was about 10 years into general practice, I would say. And, veterinarians, we're kind of type A. We're used to setting goals and achieving them, doing that whole routine. And I kind of got to the point in my career, it was like, well, what's next? What comes next? I need to set another goal. At the same time, I would say I started feeling a little expendable. I know that my clients appreciate me. I know I help my patients. But if I weren't there, that patient would get the care they need, right? I mean, there's a lot of great, capable general practitioners in our area, even a mile radius, right? There's a ton of them.
Literally,
yeah. So that patient would get the care they need, even though I know I'm helping on a daily basis. So I wanted to do something that provided more, that maybe could provide a service that patient wouldn't get otherwise. And so I started kind of looking into things. Acupuncture always piqued my interest, but there are 2 ways to get certified in acupuncture, 2 ways of learning it. And one is traditional Chinese acupuncture, and the other is medical acupuncture. Traditional Chinese acupuncture didn't really speak to me. I'm a very scientific person. I like knowing the science and studies behind everything. So for the longest time, I really thought that was the only option, and so I didn't pull the trigger on it.
Yeah.
When I found out about medical acupuncture, that spoke to me.
You're like, okay, yes, I want to do that.
I can get behind this. I need to understand why this works, and because I knew it worked, I just didn't know why. You know. So when I found out that was an option, I heard about the program through CuraCore, and I was about 10 years out, and a lot of that required a lot of these programs, most of the programs require some travel, like in-person, hands-on training, rightly so. This was at a time in my life I had 2 toddlers. My husband traveled 5 days a week. He was gone either Sunday through Thursday or Monday through Friday, and I was working, doing the daycare. Yeah, I was, and leaving town just was not in the cards for me. It wasn't going to happen. So then what happened? COVID hit.
Oh, I didn't know that's when you did it.
Yeah.
Oh, okay.
COVID hit, and the CuraCore program went all online.
Nice.
So I jumped on it.
Yeah. Smart.
That's when I jumped on it. And I think doing the hands-on training would be extremely beneficial in that moment while I was learning, but it wouldn't have worked for my lifestyle at that time. So
okay, yeah, I didn't know that's like when you did it. That makes sense though. I should have known 2021.
Yeah. So I would put the kids to bed and then I would go study.
Yeah.
And I would take my tests, and there was a lot of tests and Zooms and all that stuff, and it would be once they went to sleep.
Right.
And then I would do it.
Okay, so you did that in 2021. Mm-hmm. So you've been acupuncture certified since then, and you've been doing acupuncture like alongside being a general practitioner. You do have acupuncture days in the clinic where you work, where I've been with you. And then you've been working towards CCRP, which in a minute we'll get into exactly what that means, but that's your rehab certification. And you just finished that, which is very exciting. And that's through UTCVM, University of Tennessee. In my opinion, the best vet school. No, I'm just kidding. But it's where I'm school.
And the birthplace of Canine Rehab.
Yes.
Really.
Which is a great thing to know. Trivia. Yeah. University of Tennessee is where that came from. And it's so important. We're going to talk about it. So before we get into all the things, acupuncture, rehab, integrative, I, like my listeners know, I ask everyone if they were a dog or a cat breed. So we're going to do a dog breed. If you were a dog breed, which would it be?
I would love to know what you think I am.
Tell me what you think, and then I'll tell you if that's what I was thinking.
I have had many people tell me that I am a Border Collie.
Yep. Yes.
I may have a lot of energy. I'm always going, but I need to be the best.
Yes.
I thrive on praise.
Yes. And you are very smart and like very, I feel like goal oriented, like and type A.
Yes.
Very Border Collie of you.
Yeah, yes. So I know you're an Enneagram fan.
Yes.
I'm an very through and through Enneagram 3.
Yes.
Like
achievement.
I'm an achiever. Like, give me a goal, I will knock it down.
Have we talked about what you wing? Do you wing too?
I wing 2.
Yeah. Okay. Yeah. You don't strike me as a 4 at all.
No.
Okay. Yes. Border Collie is definitely what I would have said, because also Border Collies are like, I feel like dogs that can sort of turn it on and off, like they work, but they also can be like goofy and social and like want to lay on the couch with you.
Totally. So, but you make me sit still too long and I might go a little crazy.
You get antsy.
I do.
Yeah. Okay. I see that. Yes. 100% Border Collie. Yes. I approve. Correct. You are the winner. Okay.
Got it right.
Now, to help us dive into all the rehab acupuncture stuff, I always ask my guests to come with a hot take. So let's hear it, Dr. Frevert.
Okay. So I would say that age is not a disease. Age is not a disease. So if you're a pet owner that has an aging dog, and you think they're slowing down because they're older, which is very commonly what we hear in the exam room, consider for a moment that maybe there's a reason they're slowing down, right? Yeah. And often that reason is chronic pain.
Yes.
So, along that line of thinking, rehab and acupuncture, one or the other or both, really could be useful for most aging pets.
Yeah. Yes, because most pets, if they live long enough, as they age, they will develop a chronic disease that often involves pain, and arthritis is osteoarthritis, the most common, I would say.
Far too common.
Yeah, especially when we talk about bigger breed dogs that are more prone to it. Yes, I had an interview with Dr. Tarantino that does Senior Dog Society, and this is like one of her big things. It's like, it's not normal.
Right.
It's common as dogs age to slow down, but it's not just because they're older. It's because the older they get, the more likely they are to have chronic pain, comorbidities, frailty, muscle loss, all those things that have to do with what you do.
Yes.
So it shouldn't be a hot take, but it is for a lot of pet owners because we both hear all the time, oh, he's just getting older, slowing down, and I'm like, yeah, that means something.
It means something, right? I mean, just like with us as we age, I mean, they say, there's studies in this and there's all sorts of numbers out there, but over 70% of dogs over 7 years old have osteoarthritis. That's significant because some of these dogs are living well into their teens.
And so most dogs, especially and cats, are so good at hiding that too. Yes. And I feel like people are waiting for their dog to not want to move at all or be vocalizing or not eating to show you that they hurt.
Right.
And it's just so much more subtle than that.
Or limping. That's not, don't wait for it to get that long.
And even sometimes limping. They're like, oh, he just limps a little. He's not hurting.
He's not hurting. He's not hurting. Yes, if your dog is limping, he is hurting.
And we laugh, any vet is like, oh yeah, limping hurts. But I just think most people, if they knew that meant that is correlated to pain, they would definitely want to do something about it.
Right.
So it's education.
So as veterinarians, we know this. Age is not a disease, but it is something that I think people need a reminder about.
For sure. 100%.
Yeah.
And our dogs and cats live longer than ever now on average because they are getting so much care and prevention. And so the older we help them live, we were talking about this at work the other day, the more likely they are to have issues. And so we got to help people identify what they are. Okay. So when we talk about what you do, so you're a general practitioner who practices traditional Western medicine, but you also, like you were saying, you've set yourself apart. You have this niche, unique skill, which is, I would consider you an integrative veterinarian.
I agree.
Because you can integrate alternative, which they shouldn't really be called alternative. You probably have feelings about that. But.
Yeah. I don't really feel like it's alternative now that we know so much about it and why it works and the science behind it.
Right.
But it is because I think it's a non-traditional treatment that people are just coming around to. People are coming around.
Non-traditional is probably a better word. And so for a while you had acupuncture to offer, which encompasses can help so many patients, I know. But, and we'll talk about that, but now you've added CCRP. So tell us just about CCRP, what the certification is, how you get it, what it means you can do.
So CCRP stands for Certified Canine Rehab Practitioner. There are various programs out there. I went through the UT program. Basically what it is it certifies me to provide rehabilitation services for patients. It is specified as canine, but we can do other species as well, of course. It's just canine is the most popular. Traditionally, that is what people would think of as physical therapy. We don't use that term in veterinary medicine, but it's, after surgery for a person, they go to physical therapy, and we provide the same services for dogs.
Yeah.
So there's a lot of modalities that we can talk about, when it comes to what's all included, but it really does complement acupuncture so well because so many of my patients for acupuncture have mobility issues, and this is just another modality to really complement it, to help them really round out their treatment plan and help them succeed even more.
Yeah, so the two go together really nicely because you can use both on the same patients a lot of times, or one or the other. And then as far as the program to become certified, so you did some of it some hands-on at UT.
Yeah, I think it was about 150 hours or so. So they had a lot of online lectures to watch. And then I did have to go to UT for 4 days of labs. And that was just awesome. That's how I knew I was making the right decision. I was in a hotel room by myself going to these hands-on labs with people I didn't know who were amazing for 4 days from, 8 in the morning to 6 at night. And I would come back to the hotel and just be excited for the next day. Yeah. And it was awesome. And I almost was like, when I got home, I was almost like, I just want to be certified now, and then there was a lot more to do and which is very difficult when you're a full-time working mom fitting this in. I had to then take more online courses. I had to do some externship hours at some local rehab facilities here. And then I had to write up some case studies. So I had to do 5 case studies of my own treatment plan, and write those up and then take some exams.
Yeah, which you just finished recently.
Yeah.
And had like a exit interview for your like
Yeah.
final stamp of approval.
Yeah.
So for pet owners who are listening, they might be wondering like, okay, how do I know if my vet is certified in that, which I know most places are going to advertise that they are. And you being certified, it doesn't like, there's no governing body that says no one can provide rehab services unless they have this, but having it means you've been educated on how to do it properly.
Correct.
And so if someone is looking for a veterinarian to do that, would you agree that that's kind of like, other than a resident, somebody who's done a residency and is boarded in it, it is a boarded specialty.
It is, yeah.
But having the certification can give someone, a pet owner, confidence that like, okay, a veterinarian that's doing this, that's done that, knows what they're talking about my
Correct.
pet.
Yeah. I mean, I think there's so much value to the certification because yes, rehabilitation in general falls under the umbrella of veterinary medicine. So any veterinarian, general practitioner can provide rehabilitation services. But let me tell you,
I would not know where to start. I'd be like,
I learned so much. I learned so much in this program, and it brought back all this anatomy that I have not thought about since vet school. It's been a long time.
It's been a minute.
Yeah, it's been a minute. And I learned so much about things that really I could be using on a daily basis in general practice, but don't, and it has made me such a better practitioner, even in general practice, because now a dog comes in for a lameness and I feel much more confident in how I evaluate that patient.
Yeah.
It has absolutely rounded out stuff. So yeah, you can do it as a general practitioner. You can provide rehab services. But there's so much to learn that you are not taught in vet school, really, about rehab.
Yeah. No, I wouldn't know. I have no clue.
And maybe there are more programs now than what I was exposed to, but that was a long time ago,
Same.
Yeah.
And I'm guessing like the curriculum has to kind of coincide with orthopedic disease. Like you're learning about all of this in light of a lot of different orthopedic issues. And so it's like review of those things too, I'm sure.
And I think it does help that I have had, now do the math, 17 years of general practice behind me, because now I do have that experience to put under my belt to help me make sense of all this rehab stuff.
Yeah. Okay. So since we're talking about rehab, we'll sort of start there with like what it looks like with your patients. So I know you're like just getting started, but for just in general, like rehab patients, like who are like, what are like 3 typical patients that are gonna be good candidates for rehab? Like what situations?
Yeah. I mean, truly any orthopedic or neurologic disease. And by that, I mean, that could be, a Frenchie who is recovering from IVDD surgery.
Shocking.
That's like a slip disc. They have surgery and they need to build their strength back and mobility and body awareness. All of that rehab helps with.
Yep.
Of course, an elderly patient with osteoarthritis to strengthen those muscles. And then you have, your post-op patients, a cranial cruciate that just went in for surgery to repair that. If we had a torn ACL, we would get about 6 months of rehab or PT, And dogs, that's not an automatic prescription right now. That it should be. It should be, but it's not.
It's not.
So my hope is that changes, and I think some people do see that, but it's not the automatic yet.
Yeah. And there's evidence that outcomes, there's real tangible evidence now that outcomes are better when treatments like surgery are combined with rehab afterwards.
Yes. There's actually some evidence in people that 4 weeks of prehab before
prehab.
I
did not know that was a word. I love it. Okay.
Prehab before surgery actually maximizes the recovery.
It's like to build up muscle mass before.
Yes. So, I think it'll take even longer for veterinary medicine to get there.
Yeah.
But can you imagine?
It makes sense.
It does make sense. And then, you have your 6-month-old dog that you just diagnosed with hip dysplasia, right? And maybe is barely symptomatic or not even at all yet, but you see it coming, like those dogs we should start.
That's prehab. Yeah. That's preventative rehab. Yeah.
I mean, those dogs we should start because they have their life to go. And we know that all of these things are going to be more beneficial the earlier we start before that process really sets in of osteoarthritis.
Yeah. And, vets, as we talk a lot about weight management and patience. And of course, like that part of this conversation and important. But what I was going to say is we talk about weight management, and it's important that people keep their dogs and cats at healthy weights, but we just don't, I feel like, and I'm curious if you feel the same, we don't talk about like muscle mass, muscle scoring like we should, because that,
it's forgotten.
It's forgotten, and it's so important. And, I do a good bit of extra like research and certified in senior dog care, and frailty has so much to do as our dogs age with their muscle mass and what that index is like. And the more they can start with, like prehab before they start aging and losing muscle for whatever reason, maybe because they're less active or they have a surgery. Or I also think about like patients who get autoimmune disease and have to go on like high doses of steroids for several weeks, and they get muscle atrophy because of that.
Yep.
I don't know.
And then it's this vicious cycle, right? Their joints might be weak because of osteoarthritis. Then they don't use their limbs as much because they're in pain. Then their muscles atrophy. Or just like steroids, their muscles atrophy. Then also with steroids, that affects your ligaments and tendons, and you can tear.
More likely to have an injury.
Absolutely. And it's this vicious cycle that just spirals downward.
Yeah.
And patients really dig themselves into a hole. So imagine if we can cut that off, we can really make a big improvement in their quality and quantity of life.
Yeah. Yeah. So when rehab like services, which you're it is very integrated because you do GP medicine, and now you're going to weave this into your practice. But for like pet owners, they're like, okay, what does this look like if I take my dog to a rehab vet who's going to do a rehab program? So I assume you do like a consultation appointment first, and then like take us from there. Like what happens?
Yeah. So consultation, it always helps to have a specific diagnosis. That's not always doable.
Yeah.
Because sometimes you need advanced imaging to have a specific diagnosis. But as close to a specific diagnosis as you can have is preferable. And then we go through kind of what modalities are most useful. So that could be acupuncture, that could be traditional rehab as in therapeutic exercises, that could be at the clinic, that could be at home. I can instruct you how to use tools you have at home to do these exercises, which may or may not be doable for some people. Then there's all sorts of modalities and cool technology out there. An underwater treadmill is kind of like the mainstay.
Dr. Frevert wants an underwater treadmill.
Love the underwater treadmill. There are so many benefits of an underwater treadmill truly for most rehab cases.
Yeah.
And if you don't know what that is, that's, it's literally a treadmill in a glass box, it looks like, that tank fills up with water, and a dog will walk on the treadmill belt underwater. And you raise that water level up to various heights depending on what you're going for, what your goal is.
And I think I know the answer to this, but I'm not going to say it. I'm going to ask you.
Okay.
The reason the underwater treadmill is so helpful, tell us.
Okay. So the buoyancy basically helps support the weight of the body. So it's less strain on the joints. So it's less weight on those problematic joints, right? So dog might feel more comfortable using those joints and moving, but also that resistance of the water provides some strength training and helps develop
I didn't know
muscle.
that.
Yeah. The other thing, I love it for neurologic cases, because what goes with neurologic cases, like you think of, a dachshund or a Frenchie with IVDD, they lose their proprioception.
Oh, yeah.
Proprioception is your awareness of where your limbs are in space, right? And so often after surgery or before surgery, or even if they're not having surgery, they'll get kind of wobbly and you'll see them scuff their feet. That's because they don't have great proprioception. So what does water do? If they're in water, the water kind of provides us constant sensory input to all of the surface area of that leg. telling
it
the
helps
brain,
them remember where it is.
Right. It's this constant input to the brain, like, hey, this is where my leg is. Hey, this is where my leg is. My leg's right here. My leg's right here. I need to flip it up. Yeah.
That's really cool.
Yeah.
I didn't know that either.
Yeah. So it's great for those neurologic cases.
Yeah.
It's great for strength building. It's great for painful dogs. It's great for a lot of things.
Yeah.
Yeah.
And right now, they're hard to find.
Sure.
So like rehab specific facilities will have them. Some specialty centers, if they have a rehab, I guess, will service or whatever you call it, will have that. Universities, most of them. Well, I don't know. Tennessee has it because they are the CCRP people. But
because we go there for training.
Yeah. And much like a lot
program.
of this, you know, the equine world is ahead of the game.
Very much so.
Because equine medicine is such a sports medicine focused thing. And coming from equine medicine, you know, there's just so many like joint injections and shockwave and acupuncture. And
there's a lot of focus in equine medicine.
So much focus on all of these things. And so I feel like there's a lot of things that finally in small animal, it's like, oh, maybe we should have been talking to the equine vets a long time ago.
It's coming around.
It's coming around. And now more research behind and things like prolotherapy. So like PRP, stem cell, all of that. Okay. So other in rehab, you mentioned the exercise therapy, underwater treadmill. What are some other treatment modalities that you might use?
Laser therapy. We use that a lot. It helps with decreasing inflammation. That's like light therapy, if you will. You mentioned Shockwave.
Yes.
Love Shockwave. That's basically...
you don't have a Shockwave, right?
No.
Okay. We're going to add that to your list.
I love that.
Okay.
Yeah. I would love Shockwave. Shockwave is basically using sound waves, just like a laser uses light waves, sound waves.
Yeah.
So they're all just different modalities. I often with acupuncture connect an electrostimulator to the needles.
Oh, yeah.
So for electrostimulation, that basically like amplifies the signal that we're providing to the needles. There's therapeutic ultrasound for heating of tissues, for stretching. There's
so many
much,
things. And
so
now
much.
Something like we've been talking about just because you're excited about it. And she just went to like a conference about these things, but some like infusion therapies and joint injection, like direct injection into the joint therapies, things like that.
So there's like regenerative medicine, like, you know, you mentioned PRP, stem cells, that sort of thing. And then there's other products that are out there that were really in first equine, you know?
Yeah.
But just ways to strengthen the joint capsule, the joint fluid. I mean, there are a lot of things out there that are coming out and being developed, and even more. You know, I just went to this conference and I was like,
she was geeking out about it.
I was like a kid in a candy shop. I mean, it was just so cool to talk to these vendors about just what's out there and what science is developing. I mean, can you imagine where we'll be in 5 years or 10 years? You know, the stuff that is out there. I mean, I came back, tried this new product in some patients a few weeks ago. I was super excited about it. That's super promising. I mean, it's endless. And some of these things, you know, now because of the field that this is, and one of the reasons why I love it is that a lot of these things that are out there have minimal side effects.
Right.
You know, and when in medicine can we say things have minimal side effects?
Right.
There's side effects for everything, right? You know, there's always something.
It's like it can't hurt.
Right.
And a lot of them really, especially something like exercise therapy.
Right.
It's not going to hurt.
It's not going to hurt.
Yeah.
Like, you have to do it correctly. You know, there are certain precautions you need to take depending on a patient's recovery status. But yeah, I mean, acupuncture, we're not going to hurt.
Yeah.
Let's just try. And I think that's important to be upfront with clients that, you know, the worst we could do is fail. Right. You know, it might not work, but what do we have to lose?
Yeah. So speaking of, I wanted to kind of cover like barriers to either one, like pet owners finding like access to this kind of care, but then also like convincing owners like that they should or they might want to do this. Which one thing I think about, of course, like financial is always a barrier for any type of medicine and veterinary medicine where owners are paying for everything that is done. And this just comes with the territory, but they have to be convinced that this is worth it.
Yes.
But I just think about all these people who spend $10,000 on IVDD surgery, like back surgery, or $4,000 or $5,000 on knee surgery because their dog tore their CCL, which is like their ACL in people. Adding rehab to that,
it's a lot.
Yeah, but it's kind of like, well, you've already spent the $5,000 on the surgery, which is super important. But I'm guessing like programs like that's like a few hundred more dollars to really make a difference in their like long term.
Yeah. And I'm seeing a lot of insurance companies covering.
Oh, good.
Stuff lately.
Oh, that's great.
I've had multiple clients currently that their insurance is covering it.
I would think so, because like both of those scenarios talk about cruciate ligaments, especially if it's their first knee. Having rehab, I don't know if there's research about this, but like they're probably less likely to tear the other one if they've gone through rehab. So an insurance company, it would behoove them to cover that.
It would. And I think it's, like I said, I think we're coming around.
Yeah.
I think we're coming around.
Slowly but surely.
It's a slow process, and the insurance companies, I think, are starting to get it. But of course, those insurance plans that cover it are costly.
Yeah.
So, you always have to read the fine print when it comes to that.
Yeah.
But I am encouraged lately. Like I would say in the last year, I'm seeing more and more clients that are having it covered.
That's great.
Which is great. Yes.
Yeah, I had no idea. And that's a good thing for people listening if they have dog breeds that are prone to orthopedic or neurologic disease.
Yes.
So if you have a lab, there's a good chance they're going to tear one of their CCLs, especially if they are overweight. And so if you're getting insurance for them, I love that. See if there's a plan that would include rehab as well as surgery.
And I always tell owners when we're starting acupuncture or rehab, say for a torn CCL or recovery from a surgery for that, I don't know if everybody does this, but I always treat symmetrically, right? Like we are focusing on the damaged side, but we are treating bilaterally.
Yeah.
Because they are going to blow the other side. They're going to. And whether it's a torn CCL or something else, they're always going to compensate on the good side, which makes that good side prone to injury. That's just the way it is. That's the way we are. That's the way animals are. They're going to be more prone. So let's treat everything. And I always tell people, like with acupuncture, if a dog tolerates the needles, which most of them do very, very well, if a dog tolerates the needles, I'm just going to throw some more in on the other side.
Yeah.
And if your dog develops chronic kidney disease while we're undergoing treatment, we can throw in some needles for those kidneys. Like there is no end here if the dog tolerates it. Okay.
Acupuncture is so cool. We're going to talk about it in a second.
Cool.
Okay. And so then if a dog owner takes their dog, they come to you, they want to do a rehab plan. So you'll do like a consultation visit. And then based on like what you see and looking at everything, you make a treatment plan. Is that what you call it, a treatment plan?
Yeah, exactly. So we decide what modalities we want to use and the frequency. And some of that is based on my medical assessment. And some of that is based on the conversation that I have with the owner of what is realistic for the owner. Yeah. What can they do? What can they afford? What time can they commit? All of that plays a role. And that's all okay. That's just real life.
Yeah. So some of them are going to be coming back, I'm assuming, like once a week or twice a week or every other week.
Correct.
In the like more acute phase of something.
Correct. And then the hope is that we decrease the frequency as time goes on.
Yeah. Yeah. And then I would think a lot of patients are coming for like maintenance.
Yes.
Just like PT and human med, like every so often, a lot of them are long-term patients.
Absolutely. Absolutely. And that, frequency hopefully is a lot less, and, and it just varies based on what the owner wants to do and how the dog is doing. And I always tell people, like, we don't need to formulate the whole schedule right now, because we might go down to once a month treatment or even once every like couple months, and then they slip, or, it was icy outside, or they're just, another year older and we need to change that plan. Yeah. And like, just contact me, everything's always in flux. We can go up and down.
Which do you think is going to be your favorite modality? Do you know yet? You're like
Shockwave.
Shockwave. Really?
Yeah.
Okay.
Yeah. Well, an underwater treadmill, I would say, like, hands down is like,
that's a very big toy.
Yeah. That's like just.
That's like the end all be all.
Understood that that's going to be. Yeah.
Yeah.
But fun. handheld toys. Yeah, I think
Shockwave.
Yeah, Shockwave. Yeah.
Okay.
Yeah.
Are they expensive?
Yeah.
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 We did a good bit of Shockwave when I was in equine medicine. Yeah.
What I love about Shockwave is that you can pair it with a lot of, like, for a PRP injection. There's actually, so PRP is platelet-rich plasma, which you can inject into joints. You take the patient's blood sample, you process it by filtering out the platelets, and they have all these very beneficial proteins and growth factors that can help decrease inflammation in the joint. So you do a joint injection with PRP, and there's actually evidence that if you shockwave at the same time, it actually maximizes. It's kind of synergistic. So
is it like
shakes everything up,
shaking up the PRP molecules, like do your thing?
Yeah.
It's just like having a little rave before they get started.
Having a party.
Just like
get them going,
in the joint.
get them excited. Yeah.
Okay. Yep. Yeah, that PRP is so cool, and stem cell therapy. They're both so very cool, and I think used a lot in human medicine too.
Yes, yeah.
And PRP, like, dude, PRP is used like for skin stuff in people.
It's a lot.
I'm like, I want a PRP machine just so I can like make it and put it on my face.
Well, and I think all of this stuff coming around in human medicine really has helped people have a more open mind. Like, you know, there's
because they've heard of it.
They've heard of it. There's all this talk of red light therapy, you know, in people.
Yes.
And I think that even though it's not exactly the same thing as the therapeutic laser that we use, it's the same line of thinking. It's light therapy.
Yeah.
And so people kind of now know, you know, and are more open to it.
Yes. We were talking about this the other day. I think it was you and me. We need to say this because someone asked me the other day, like, oh, there's this laser therapy unit on on Amazon. Should I buy that for my arthritic dog? Because I've been taking it to my vet.
No. No.
The answer is no.
The answer is no.
Doctor, I'm going to give her credit because this is what I said to that person online. I was like, that's like taking a pin light and shining it on there.
Yes.
It's not the same.
Not the same.
Those toys that we have in vet med, like the therapeutic laser, they're like $30,000 machines.
Yes.
So
it's a much higher power.
Yes. But red light is different from that.
Sure.
But when we're talking about laser therapy, that is not the same.
It is not the same thing.
Don't waste your money.
Exactly. It is not the same. I mean, that goes for most things you can just get on Amazon, right?
It's not going to hurt. Probably the pin light laser. But it's probably not going to help.
Just stand under the kitchen light.
Well, and that's the thing. It's like those sort of products we hate for people to, one, of course, like waste their money on it, but two, skip their therapy laser appointment at their vet clinic because they think they bought this machine that can replace it. And so then their dog has missed that modality that helps with their pain.
Right.
And so then they get behind on pain management.
Or just says no to any of these integrative modalities because they think they already tried it.
Right. Yeah, exactly. Okay, so let's talk about acupuncture because I just am fascinated by it. Have always been. I've like thought about doing it as well. I know you love it. You're good at it. You've been doing it now for a few years. And you do a good bit of it. So like 2 days a week now,
2 days a week.
You
pretty full
see
schedule.
acupuncture patients and you do a lot. So there's so much we could talk about. But I guess I didn't really warn you that I was going to do this. But can you give us like explain to me like acupuncture for dummies, like those books. Like what is acupuncture? I mean, we all know that you're like putting these tiny needles in certain places.
Right.
But like the overarching idea, tell us.
Yeah, so you're putting these specialized tiny needles in specific areas of the body. And those areas either might be around various nerves or where the spinal cord branches off into certain nerves or vessels, like a vascular bundle or trigger points. There's all different areas.
Yeah.
Those areas, depending on what you're treating and what the outcome you're going for, communicate with other areas of the body. And they might communicate via those nerves or via those vessels or via connective tissue. And they send signals to other parts of the body and sometimes even the brain to then release and communicate with other parts of the body. So it's this whole very intricate system that truly I was surprised about learning about, even though we have neurology class, in vet school, and we learn all these things in vet school. I was actually very impressed / intimidated when I was taking these courses, because it really is so much more intricate than anybody can ever understand. It's fascinating. But basically, the cells, when they're, stimulated from any number of reasons, they can release different communicating factors like growth factors and proteins and cytokines. There's all these different ways that cells communicate with each other through the body, to then achieve certain goals. So that might be to decrease pain, that might be to decrease inflammation, increase blood flow, release endorphins. There's actually a very cool study so opioids, right? Like morphine, heroin is a opioid, and everybody has heard of by now Narcan. Narcan is the reversal for an opioid. So if somebody overdoses on an opioid, you give Narcan. Well, they actually did a study that Narcan, also known as naloxone, can actually reverse some of the beneficial effects of acupuncture.
Really?
So cool, right?
Yeah.
So cool. So what does that mean?
So acupuncture is doing what opioids do. Oh, that's really cool.
Very cool.
Wait, that's really cool.
I know.
I have goosies.
See?
Okay.
Acupuncture
That's very cool. Yeah. So like if I'm sure you don't know all the specifics of the study, but like if a patient was like clinically better because of acupuncture, the Narcan, like, or did they, was it on a cellular level?
So endorphins being released is one of the benefits of acupuncture, but it works on so many other levels that it's not going to like reverse all of the benefits of acupuncture, because there are so many ways that you get.
But they looked at specific markers, I'm guessing.
Yes.
That is so cool.
Yes.
Okay, so that's like the idea. And I'm sure doing the medical acupuncture side was helpful for you too, because it wasn't just like, I don't mean to like minimize the other side, but there was like more tangible.
Yes. So the points are nomenclature for, like, if you read my notes, it's probably gibberish, because it's all the points are named certain things. And that's exactly the way the nomenclature is in Chinese acupuncture too. We use the same system just for consistency.
Yeah.
And the points are the same, but there's neuroanatomical landmarks for each of these points. So if you watch me acupuncture, I'm like counting the vertebrae to know exactly where I am on the body.
So it just correlates to what we already know.
Yes.
Okay.
Yes.
Yeah.
And truly, and I tell clients this all the time, if I were treating a patient or a Chinese acupuncturist were treating a patient, we would probably come up with a similar treatment plan. The patient would succeed either way, It really doesn't matter to the patient. It's just the logic behind it is different.
Yeah.
And I like knowing about the science behind it. So, that just suits me better.
It's how you got there.
Yes.
They're going to get the same type of care. Yeah. And I think everybody realizes, or at least I guess I realize acupuncture can be used for like pain management. But I know there's just like so many different things. So like maybe just share a couple things that you use acupuncture for in our patients that we think maybe like the average person wouldn't realize acupuncture can help with this.
Yeah. So, anxiety. I see a dog twice a week, and simply for his anxiety.
Where do you put the needles?
Where?
Yeah.
Okay. Well, he only tolerates them in certain places because
he's anxious.
Yeah, because he's nervous. So I do this really cool thing. So I have 5 needles that I put in.
Okay.
Do you want me to tell you the points? Or
like general.
There's some relaxation points.
Okay.
And certain ones that he is more willing to let me do than others.
Yeah.
But then there are additional points that I would like to use in him that he doesn't tolerate too well. So I use there's a setting on the laser for laser acupuncture, actually. So I use the laser acupuncture setting to stimulate the other points.
Those points without actually putting the needle.
Yeah.
Because the needle, like what gauge are the needles?
Well, they're
different
like,
ones.
There's different sizes.
Like a 25, 27?
27 probably.
Okay.
Yeah, 27 gauge probably.
But they're like different.
They're different sizes. So there's like 0.18. I use the 0.18s or 0.2. And then they're 25 millimeters long.
Okay. Yeah. Okay. And so you have relaxation points.
Yes. Yes.
And
so
he keeps coming, so it's helping.
yeah, I go to his house twice a week. He is awesome. And, I mean, I have just grown to love this dog.
Yeah.
I mean, most of my acupuncture patients, you just get to know them so well.
Yeah.
And I just love them. But he now snuggles me. He comes and gives me kisses. I acupuncture his brother first for completely separate issues. And he tries to steal the show and come. And it's just like awesome.
And you go to him, which is helpful.
Yes.
If he's anxious, I'm sure.
Yes. Yes.
Okay. So anxiety, whatever
Yeah.
kinds of things.
Chronic kidney disease, I
Yeah,
mentioned
I
that a
heard
little
you
bit more.
mention
Yeah. I mean, this is good for cats too.
Yeah.
Now it's a harder thing to measure though, right? Because mobility issues, when you're acupuncturing for mobility issues, you can see the benefits before your eyes. You can't really see the benefits.
Because it's probably just slowing down progression.
Correct.
But we wouldn't know how fast it would have progressed without it.
Right. There was this cat that I used to acupuncture multiple times a week, 2 or 3 times a week actually for years. And I believe it really helped him. And I know the owner did too. We all did, because before acupuncture, he was in a feeding tube. He had a feeding tube. He was declining. And chronic kidney disease, as you know, it can be a roller coaster.
Yeah.
But I mean, I probably acupunctured him for a few years. He would come in for his sub-Q fluids and acupuncture, and he was a little spicy, but he tolerated it just great.
Chronic kidney disease.
Yeah.
I guess like anywhere there's inflammation, like.
Right.
Have you ever done it for cystitis cats?
No, I have not done it for cystitis cats. I currently am seeing an IVDD dog that has recurrent cystitis, resistant UTIs. This is actually one of the dogs I gave that injection
the infusion.
to. Yeah. And I will add points for her bladder and laser her bladder as well.
Oh, yeah. So I'm guessing, would you say the majority of your acupuncture patients it's like a pain? You're treating pain, arthritic pain, I would say. Is probably.
Orthopedic or neurologic.
Yeah.
Most are senior patients, I would say. A lot of neck or back pain, hip arthritis.
Yeah.
And
when they come to you, do you usually know sort of from the initial consult, like, okay, I want to treat this many times for the next so many weeks, or you just sort of start and decide how often and then sort of see how they go?
Sometimes a little both.
Okay.
It really depends on the owner.
Yeah.
And where they're at with how much they want to commit, and if we want to see, and if it works, and time and scheduling and that sort of thing.
Yeah.
Most orthopedic problems, if they're really showing clinical signs, I like to start at twice a week.
Yeah.
What I like to do is start at twice a week, and I tell them, like, in an ideal world, we do it twice a week, and we reevaluate after a month. And at that month, if it hasn't helped by then, it's not, let's cut our losses. It's not going to help. It's not going to help. But if it has, then the question is, are we still improving every time beyond the last treatment? So if we're still on this upward trend, I don't want to cut it short. Let's keep going. Keep it at twice a week. Keep it at that while we're still improving until we plateau. And if we plateau, and when we plateau, then that's when we say, okay, let's cut it back to once a week. And if we're still plateaued and we're holding our ground, then we say, hey, let's cut it back to every other week. And we just keep challenging it. And what often happens is that there are some built-in just life things that happen. I go on vacation, or an owner goes on vacation, or an owner has an appointment. They have to skip, or somebody gets sick, and we have to skip a week. And then that,
see how they do.
And that tells us, like, okay,
we can go to every other week.
Yeah.
Okay. Yeah. So a lot of those patients, that's a cool thing about just being a vet who does these things, because you just have so much follow up and follow through.
Yes.
And obviously, at least for right now, I would assume most of the clients that are doing this are like amazing pet owners.
I mean, it
super dedicated.
Self-selects for amazing clientele.
Yeah.
I mean, it really does. And one of the things I love about it is that it's acupuncture rehab. It's really just me, the owner, and the patient.
Yeah.
Which is
it's like
awesome.
intimate.
It's very intimate. And I get to know these people so well. They get to know me so well. I mean, truly, they become like family. I
And it's a bunch of crusty dogs.
Yeah, I know. You love the
crust,
crusty dogs.
So I'm jealous about that too.
I mean, and sometimes like a little ornery, you know, but I just love it. Yeah. You know, like when you win over that dog, you know, it just makes you feel good. So
the ornery ones, they have charm. It's okay.
I know. So yeah, it's really fun because you develop this relationship with the pet and the owner that you wouldn't automatically have otherwise in a 15-minute appointment.
And people are always going to wonder this, but like anyone listening who's has no concept of, well, what does it cost to do these things? So for acupuncture or rehab, I assume most practitioners have like bundle type, like a package, this many sessions.
Yeah, I do like a package of 8 because that makes sense to me. If you're doing twice a week for a month, you know, we see how the month goes. The initial consult is a little bit more. Yeah. And then we just kind of reevaluate as time goes on. Yeah.
Yeah. So they make it so it's not you're paying like $150 every time you go do it. It becomes more affordable as like a package.
And owners love that. Then they don't need to stop at the front desk every time and pay. And, you know, they just come in and out. They come in the acupuncture door. They leave right away. It just, you know, we're in our own world.
I wonder if anybody who does this like all the time has like a subscription based model.
Yeah.
Like somebody who has like 4 pets and they love acupuncture. It's like, okay, you can pay like a household.
That's right.
That's a good idea. Acupuncture subscription. You can have this many a month or whatever. You heard it here first. If you do it, let me know.
Okay.
Okay. I could just listen to you talk about this all day because I think it's so cool, but we're going to run out of time. I had a list of questions and I haven't even looked at it. Let's see. Okay, this is a good one. When should GP vets or like pet owners be really considering referral to rehab or acupuncture? I mean, we talked about like post any kind of like orthopedic, neurologic surgery. But like, let's talk about senior dogs or cats since that's a lot of your patients. At what point do you feel like more should be saying, let's think about that?
I think at any time, really. I don't think that there's, you know, a cutoff of like, now it's bad and we need to go. I mean, the earlier you go, the better. I mean, we work out, you know?
Right.
And I don't work out for my 42-year-old self. I work out for my future 70-year-old, 80-year-old self. Like that's what I'm doing it for. So I can be functional and have a good quality of life 30 years from now. And that's what we need to think about with our patients, you know?
Yeah, and it shouldn't be like, oh, we'll try this NSAID, and if that doesn't do enough, then maybe we'll try rehab. It's like these things work well together.
Yes, and my hope is that if acupuncture and rehab really are successful, we can get patients off those long-term meds that could have side effects.
Yeah, for sure.
Yeah.
Oh, the future is bright. I'm excited. Okay, most underrated rehab tool. It's probably gonna be the same answer. That's what you want. Shockwave. I don't hear about people using Shockwave a lot.
I mean, I think everybody in the rehab world wouldn't think it's underrated because they know how valuable it is.
They're like, you know? I'm not underrating it, but everybody else is.
People just don't know about it. I didn't know about it. I didn't really know about it.
Well, and that's an interesting thing because a lot of GP clinics now have therapeutic lasers in their building, which lasers are kind of like dummy proof, like anybody can do, because if you're listening or watching and you don't work in vet med, we have these great therapeutic laser machines that cost a lot of money, but part of what you're paying for is anybody, whether they have experience doing that or not, they can pick up the machine. It has instructions, like
very user friendly.
You say what kind of dog, how big it is, what you're treating, and it tells you exactly what to do. And so I think it's appropriate for those to be in GP practices in everybody's hands, but I feel like maybe Shockwave would be different.
Yeah, I mean, there's definitely, I think, more expertise associated with it. Now, that's trainable, you know.
But you're like, just hire a rehab vet.
Yes, but I really think
the other thing about rehab is that I would hate to not talk about is how vet tech driven it is as well.
Yes.
Veterinary technicians can also become, is
certified.
It the same certification?
Yeah.
It's the exact same. Yeah. Okay. That's what I thought. Yeah. So also super important because the technicians are who are doing a lot of those treatments after the veterinarian has come up with a plan, right?
Yeah. So the veterinarian's job is to really diagnose, come up with the treatment plan, and the techs can be the ones who execute it, really, which, makes it flow much better because we can be doing multiple things at multiple times.
Yeah. And I love it because of that, because I love for veterinary technicians to feel empowered to really have.
They're making a difference.
They're making a difference, and they are such a big part of like a care team. They're not just picking up poop and drawing blood. They are doing so much for our patients, and I think we in general practice could learn a lot from the rehab model of veterinarians are using their like trained, educated brain, higher education to like come up with these plans. But then the techs who also have education are the ones who are just really like the ones doing that with the patient and taking care of the patient and using both their skills and their knowledge to see it through. And that should happen more in GP. And I think that that's getting more popular. It's certainly what I want to accomplish in my practice. Just like the techs are just as much part of the like treatment team as the doctors, and probably even more so. Right. So I think that's really cool.
And how fun it is a rehab therapeutic exercise with a patient, I mean, it's like you're playing.
Yes.
It's fun.
I know. And those are cool things that owners can do at home too. Okay. I'm going to bring up something controversial right at the end. You left it in the outline.
Oh,
the chiropractor thing.
Yeah, we can talk.
Can we talk about it?
Yeah, sure. Yeah.
Okay. Let me readjust for this conversation. Which I don't totally. Well, I understand the legal part of it, but so what had happened is that we're in Tennessee, and there was a bill that was proposed in Tennessee government. I don't know all the terminology about that, but a bunch of politicians in Tennessee decided they would make a decision about whether or not chiropractors who are human, like certified human chiropractors, can also do chiropractics on animal patients without any other kind of training or certification. Correct me if I'm wrong.
I believe they have to have a certification. I thought they did.
I think they did have to.
Okay.
But I think the bill made it so that they don't have to. They have to have it in human, but they don't have to have an. They have to be a certified human chiropractor.
I thought they had to have an animal certification as well.
We might cut all of this because I might be wrong. But I think that the new bill that got proposed and passed, the whole shtick was they didn't have to have any other certification to work on animals, because I know that the TVMA lobbied to not let it pass.
You might be right. I feel like
or maybe I'm wrong, and the bill made it so that they had to have certification, and the bill didn't pass. Whatever happened, what I know is it means that chiropractors who are human chiropractors in the state of Tennessee can now work on animals without any animal qualifications.
Yeah, I mean, I feel like my response would be the same regardless, honestly. I feel like you should be a veterinarian.
100%.
I just, no matter what, certification or not certification, I don't feel like a human chiropractor should treat animal patients, period.
Right.
These patients that we're treating can't talk to us.
Right.
They cannot talk. They cannot communicate where they're hurting or how they're hurting, and what one person does to them, how that makes them feel.
Yeah.
And yes, they're not communicating to us either.
But we're trained
but
on
we're
knowing what that looks like.
Right.
Yeah. So I wanted to bring it up. Well, I want to know if you had any big thoughts about it, but I mean, I'm glad we feel the same way. Yeah. This is how all of the veterinary community feels.
Right.
The politicians in the representatives in the state of Tennessee did not listen to the veterinary and medical communities. I think they're probably,
I know.
I'm sure there's money involved, all the money. But sadly, who will suffer are animals.
Correct.
And so I really wanted to just cover this because it was relevant. But also, if you're listening to this and you own a pet in the state of Tennessee, and you want to take them to get chiropractic work done, neither of us would recommend that you use a human chiropractor.
Correct.
Because they just are not, now they don't have to be, and they just are not trained on how to properly and safely take care of animals. There are veterinarians who do chiropractics.
Yes.
So, I'm not saying it's not an appropriate treatment modality for some patients, but it is not appropriate for human chiropractors to be doing it. I mean, agreed. I had a personal friend the other day say oh yeah, my chiropractor's great. They'll work on me and my dog. And I had that internal,
I know.
I didn't say anything because I just didn't feel like getting into it.
Right.
But I'm just that's because of this bill. I can't, I don't know if it was the bill passed and made it out, or it didn't pass. And so that's how it is. But, so this is just, and I'm sure there's probably other states like this.
Yeah.
But, it's not all states, but at least in Tennessee, I know that now your chiropractor, for you, a human, can work on your animals if they want to, but you should not let them.
I just feel like it should be very simple. Any treatment of animals should be under the umbrella of veterinary medicine.
It's just crazy to me because it's no one in their right mind would ever pass something that said that we could work on humans just if we feel like it.
Right.
I mean, during COVID.
I'm not allowed to acupuncture humans.
Right. Exactly. And during COVID, they made some exceptions for veterinarians to help with some human stuff. But in no other scenario would that happen. Right. So, okay, I'm glad we're on the same page about it.
Yep.
Okay, so before we completely finish, anything you just, we didn't talk about, you want to make sure pet owners know about it?
I mean, we touched on this a little bit, but I think the importance has not been stressed, how important it is to keep your dog a lean, healthy weight.
Oh, yeah, totally. Yeah, let's
I mean,
talk
that's
about it.
number one.
Yeah.
Right? Before anything else, before medication, before anything we talked about, rehab and acupuncture, please keep your dog at a healthy weight.
Yeah, I'm guessing if you ever see a patient for any of the above things you talked about and they're overweight, that's going to be just as much part of the conversation as everything else.
I mean, it's number one. You could really avoid a lot of problems.
Yeah. Yeah, it's always I talk about this sometimes online, but it kind of drives me crazy that people want to argue on the internet about what to feed their dog, fresh food, raw food, kibble, vaccines, flea tick prevention is like so bad. People want to, talk about all those conspiracies, but I'm like, if I don't care what you do when it comes to all those things, if you have if your dog and your cat are not at a healthy weight, that is the most detrimental thing to them. And so the other things are not even an issue. You shouldn't even be talking about that if you have a morbidly obese pet, because that we know that shortens their lifespan. It makes them so much more at risk for things like diabetes in cats, orthopedic disease in dogs. Yes, you brought up one of my soapboxes, but it's such a
rightly
thing.
So.
Yeah. And people want to have a lot to say about the cost of veterinary care, and that's fair, and everything costs more in the world right now, and human medicine is a mess. But I mean, vet care would cost less if your pet was at a healthy weight.
Yes, it affects everything. It affects everything. Yeah. Purina did that study many years ago that showed a group of Labradors that were overweight compared to a group of Labradors that were a healthy weight. And the healthy weight group of Labradors outlived the overweight ones by almost 2 years.
Yeah.
2 years.
Yeah.
It's huge.
It's crazy. Something else interesting I learned at CE recently from my friend Dr. Tarantino. We all are aware intuitively that metabolism changes after we spay and neuter our pets, which is a whole other conversation of when. But regardless when people spay or neuter their dogs and cats, there's some more recent research that proves that their fat metabolism changes within 48 hours of that surgery because of the hormone fluctuation and change. And so in this lecture I was at, they were just talking about how we in GP should probably be prehabbing our spays and neuters. I'm going to use it all the time now, but to let these owners know, hey, your dog's metabolism is going to change as soon as we change this. And so we need to account for that with what we're feeding them and how much. And so they were just talking about how it's probably a good idea to like go ahead and have a convo with these owners about reducing the caloric intake and maybe like bumping up protein, like changing the protein to fat ratios of their diets, just because we're going to spay and neuter them and doing it before we do their surgery. But that, I think it's just like more, it's just like so important.
Yes.
And
Getting ahead of the problem.
There's so many patients we see that are overweight. And it gets exhausting to talk about it all the time.
Well, and how many patients have you had that if they're an ideal weight, the owner has heard from the neighbor, like he's too thin?
Oh, especially if it's like a lab or like a golden.
Because nobody's used to seeing normal weight.
No one knows what a lean lab looks like. Go look at Cooper. But yes. And yeah, we'll have people, they're like worried. I think they're too thin.
Yeah.
I'm like, no, perfect. Don't change anything.
Yeah.
But it's exhausting to talk about it all the time. And it's okay, we will. But sometimes people also get very offended.
It's like bringing up politics in the exam room. It can be
like
so
religion,
combative.
politics, your dog's weight. The three things.
Nutrition, what to feed them. It is same level.
Don't you dare ask them what they feed their dog, and don't you dare tell them that their dog is overweight. I don't know what that is.
It's so hard, but it's just like simple things. And people, here's what drives me a little crazy is people complicate their lives, right?
1,000,000%.
Like there are these amazing, great, knowledgeable food companies out there that have done the work. They've done the work to figure it out, to hand you the perfect food that you can put down in the bowl twice a day very easily without preparation and just 100%. Put it down and they can eat. And yet people just want extra work. I don't understand. I don't understand it. I don't understand.
They want life to be complicated.
I just let's simplify things, people.
I think marketing has just gotten so good.
Yes.
And so and then so much misinformation is so rampant online that people, they're genuinely scared.
Yes.
And I always say to clients that when they're telling me about their complicated life with their pet, I always say to them, I want you to know that I only have these conversations with awesome pet owners. Like I know that I'm having to have this conversation with you because you really care, which is why you're doing all these things.
Yes.
I'm a big fan of fresh diets, whole cooked fresh food, not raw, but fresh whole foods. But you either have to spend a lot of money to buy that commercially, or you have a really complicated life where you spend 4 hours every Sunday cooking for your dog and you got to get it formulated. And it is complicated. And, people are like, oh, I just make my dog some chicken and vegetables. And it's like, that's such a involved conversation.
I know.
And it's like, okay, but that's still not.
It is so hard.
Yeah, it's hard. It's hard. And there are options, but doing it the wrong way, even if it's fresh, is more detrimental than whatever you believe is wrong with kibble. And that's a hard thing to get across.
I think it's exceedingly difficult to get across. Back to acupuncture for a second, because this is one of the reasons I love it so much is because of that bond I establish with owners. And I feel like it has helped getting to know people very well because they get to know me very well, and I gain their trust over time. And that is so valuable because, then they know what my dogs are eating. And
they're more likely, I'm sure.
And they're more likely to, because I'm just a human being who has this knowledge and training, but I really just want what's best for their pet. I genuinely do.
Yeah. And
so
you're not getting
I'm not getting any kickback
from the food company that sells their food at PetSmart that you have nothing to do with.
Right.
Yes. Okay. So all of that to say, keep your pets at a healthy
place.
Weight. And, it's not all on pet owners. I think some veterinarians probably are burned out talking about it.
Sure.
So they don't even talk about it anymore because they're tired of feeling like they're the bad guy for talking about it. And I try to make it more fun and tangible, showing them. Or with the right person, I can joke, I want to be able to feel your dog's ribs.
Yes.
And there's a whole slab of fat over this dog's ribs. Yep. And so, some of that just to help them have tangible things. And sometimes we can make a little bit light of it. But sometimes, man, people are just very offended.
It's like a personal attack.
I do think they take it that way. So, but so don't be offended.
Right.
We just recommend that because we want what's best for pets. and it will save you money if you're not having to pay for TPLO surgery for a torn knee.
That's right.
And then the next one
That's
next
right.
year. So, okay. If you couldn't tell, Dr. Frevert and I like to talk. Both of us, and we like to talk to each other. So this is really good.
Yeah, this is awesome.
I think there's probably a lot of people listening who had no earthly idea what rehab veterinary medicine meant.
Yeah.
Or even like what acupuncture really involves. So hopefully you all found this helpful. Dr. Frevert, if you live here locally, if you want to see her with your pet for acupuncture or rehab, she is at Little House Animal Hospital.
Yep.
All the time.
But every day.
You can get in with her for those services there. And that's here in Franklin. So yeah, definitely check it out and come see her. And yeah, you can check her out. She's in a lot of my social media these days. So you can find her on my page
It's
too.
been so much fun. Thank you for having me.
Yes, it has. Okay. Yeah. Thanks for coming.
Yeah.
This has been another episode of the Dr. Molly Says podcast. If you want to follow us, we have an Instagram and TikTok, Dr. Molly Says Pod. If you're listening to this, you can watch it on YouTube. And if you're watching, you can listen on anywhere you find podcasts. And we will see you next week.